Good almost afternoon to everyone from Skopje here. My name is Dona Kosturanova, and I will be the moderator of the first panel of the International Youth Conference today. So, what we have today is a plenary session titled Solidarity in Crisis, Humanity Beyond COVID-19. What we're going to talk about today is, let's say, if we would typically say the elephant in the room, today the topic are the viral particles we have in the air, the topic that we cannot avoid and we cannot have a conversation without about the future of democracy and society without taking into consideration. So, although this is a youth conference and traditionally deals with difficult topics, however, health has quite often not been part of these difficult topics that we're considering in society and on such civil society gatherings. But this is an unprecedented time, and this is a topic that last year we could not anticipate we will have, but now is the only fitting topic to start our event with. We want to discuss humanity, we want to discuss it, as it perseveres, and as it develops beyond COVID. The COVID-19 pandemic has led to a dramatic loss of human life. It presents an unprecedented challenge to society, and it also challenges the delivery of essential medical care, the economy, and also education. It has greatly confused our ability to predict and to plan for the future at the same time. We do not have explicit and exact answers on the questions such as how long will the pandemic last, or what will society look like once it's over. But we need to have meaningful debates and discussions in order to better understand and anticipate these questions. So today, we're tackling three key issues. We will be talking about social distancing and distrust. We will be talking about access to healthcare, and we will be discussing economic collaboration, with space to address all of this in just under 2 hours. What will the format of today's discussion be? We have these 2 hours, and we have 5 amazing speakers that will contribute to this panel. They will all have 5 to 10 minutes to make their addresses, after which we will open the floor for questions. Now, if you have questions in the meantime, please make sure to write in the chat box. I have my trusty tablet here with me to make sure you are first on the list of people to participate in the discussion once we cover the panels. If you have questions in the meantime, we'll also make sure we open the Q&A in a way where everyone can make sure to participate in the dialogue. So, we have the remarkable participants of the International Youth Conference from all across Europe and 5 outstanding speakers that have been assembled to make and help us make a deep dive into the reality of our world as it is today. We have Dr. Vinko Filipča, the Minister of Healthcare in North Macedonia. We have Professor Nenad Markovic, who's here with me in the studio, so to say, in Skopje. We have Mr. Ervan Bržanov, a research executive for the Rare Barometer program. And finally, we have both Mr. Jason Nardi and Ms. Sofia Pereira, who come from REPES EU and will discuss about the economic implications of this crisis. Without any further ado and too much introductions on my part to the topics, our first speaker is a very well-known face to everyone who lives here and is part of the domestic attendees from North Macedonia, because you have undoubtedly been seeing him almost every day on daily press conferences since the start of the crisis. Dr. Vinko Filipča is the Minister of Health in North Macedonia, but also by profession a neurosurgeon, and in fact a member of the Executive Committee of the Association of Neurosurgeons in Southeast Europe. North Macedonia was one of the countries that initially achieved some of the, let's say, more manageable results in the first months of the crisis. And although we've grown familiar to reports on numbers, to the rationale of the various health protocols, North Macedonia managed to be among the safest, at least at the very first initial stages of the crisis, but the numbers, as in everywhere else in Europe and the world, are creeping up on us again. We will put the focus on the measures themselves and the impact they have on society as a whole. There are many questions to ask the minister, and I'll resist the temptation to ask domestic questions as this is an international event, but I'll start with this one. As we are aware of the major developments of the pandemic, the characteristics of the disease, the questions it lays ahead, we rarely find time to look at the impact it makes on society and the measures that are permanently leaving behind. Social distancing, particularly in societies with close knit fabric, with large families and generations living under one roof, with active social lives and comfort in peer groups, create threats from support systems we would usually rely on. What impact will this have on the long run? How sustainable is it, and how long can we last like this? How do we overcome the intergenerational divide and find solidarity between generations, but also across different social agents? Where does trust play in the game when we looked at the overworked medical personnel on the front lines protecting our lives and the dissatisfied citizens that are struggling with their jobs, with their education, with their employment, and sanity even? How long can we last? What are we doing to prepare for the long game? And what implications can we expect for societies in the world? Mr. Filipce, you are welcome to have your address.
Thank you so much. Thanks for inviting me. We faced a kind of crisis that no health system in the world was prepared to accept and was not prepared to face such a challenge in which a new disease would appear, which would require to be treated fully separate from the other patients, having all the staff fully equipped, as for none of the, at that point of time, existing diseases around the world. In the very beginning, there was a kind of individual approach of all the countries around the world towards this issue. Every single country got towards the restriction of movement, even a curfew. And as it is now clear that not many of the predictions in that time appear to be true, because the predictions were based on the experience of the epidemics or pandemics of the disease caused by the viruses in the same group as SARS-CoV-2. But this virus appeared to be completely different, completely unpredictable in terms of epidemiology, way of the infection between the people, and also in terms of the clinical course of the patient. This type of disease is something that it's so strange that I think that we still don't know everything. It's still not clear why some patient is asymptomatic, why somebody has a mild form, and why somebody is dying, although everything is done by the medical staff to save somebody's life. I think that science has to answer this question in maybe next period, which is probably going to take more than a year from now. In the beginning, all of the countries went towards limiting of the movement, curfews and stuff like that, which helped at some point. But then the virus appeared again to be in between the people, to present with the local transmission, and now we have this huge rise. I think that none of the countries in Europe has expected this type of rise of new cases. Now the hospital capacities, at least in our region, also I'm seeing some of European countries are under huge pressure. We are doing our best to provide more and more hospital beds, but also to provide staff to treat this type of patients. We had a meeting with through Berlin process with the countries of Western Balkan, and now it's pretty clear that we are trying to implement the measures which are not going to fully restrict the movement of people, but to prevent the gatherings and also to recommend mandatory wearing of masks, which are the two principles of prevention, which stayed from the very beginning. And now let me just comment on what this very specific topic is. And this is the social distancing and distrust. I have many experience in treating the patients who had their problems in the specialty of neuroscience. And when there is a kind of stress, whether it's caused by a disease or a kind of societal stress, then it is now recommended what was never recommended until now, and this is the distancing. And the people are used, even with many years of the evolution, that in times of stress, they should stay together. And this is hundreds and thousands of years of evolution, which is was actually teaching us that the people should stay and stick together in order to overcome such a problem. And now we have completely opposite recommendation, which certainly has some type of let's call them side effects from the medical point of view. There is rise of the hormones which are anyway increased with the existence of the disease or with the fear, and now are even more increased with social distance. We have anxieties in the people who need to be treated and to be quarantined during the treatment even more, which is another problem. I have been talking to some of the experts with from psychiatry department these days in our country. We have enormously increased number of consultations over the phone asked by Macedonian citizens who needed support due to anxiety, like 5,000 calls in the past period. We have almost double the number of suicides, which is the half of the year data we will see by the end of the year, which somebody from Department of Psychiatry is taking into relation with social distancing. And it's a kind of vicious circle. You need to do something to stay alone, which is increasing the levels of stress and cortisol and everything else, which we know that are decreasing the chances of recovery. So this is why this situation is completely new, is something that we have not faced before. And now we are facing, just to be short, because this is pretty broad area to be discussed, we are facing questions and issues how to overcome this type of situation, whether we can use technology to overcome it, what we should do in order to resolve all these challenges. And I have a personal opinion on this. Maybe phone calls and are something that can help. Maybe during social distancing and even quarantines due to isolation, due to contact with somebody who is positive, we should talk more. At least this is a chance that we contact more people. We cannot see everybody during the day like in normal times, but we can use phone calls, we can use Zoom platforms or whatever to contact as more people, to share our feelings, to share our thoughts. By doing this, I think the stress level has great chance to be decreased. It's also an opportunity to increase the levels of, let's call them, good hormones, not like cortisol. Then I think I think we should shake hands. I think we should skip this. At least we have some type of contact. I think it might help. Of course, this is going together with frequent hand disinfection and cleaning. But anyway, by communicating with more and more people, by sharing our experience, by sharing our knowledge from everything that we read online or in any publication, I think this can help. This situation is probably going to last at least by the half of 2021. I was quarantined once because we had this contact with somebody who was tested positive. During these 2 weeks of quarantine, my screen time was on my phone was 13 hours, and it helped because I was okay doing my job also, but also communicating with so many people. Okay, not to take much of your time. Thank you everybody for the participation. I think that by sharing some of my thoughts can help develop discussion. I cannot stay along at this meeting, but I will be here some more time for questions or discussion. Thank you everybody, and thanks one more time for inviting me.
Thank you, Minister. That was some interesting points you brought up and definitely gave us food for thought on how to continue with the panel. I particularly appreciate you bringing up the mental health in this whole ordeal. These are staggering information that I'm sure many of us were not aware of, but were anticipated, to say the least, particularly with young people. Many of the professional associations were warning across the world that we will see a rise in substance abuse, we will see a rise in anxiety disorders, and a lot of these things definitely take their toll. They're as much as real as other types of diseases as well. And in that sense, I just want to bring up a positive example of things we saw. In this country, we saw an SOS helpline for psychological support for persons that might have been in contact or have family members that are affected by COVID. And one positive thing here was also the fact that it was available in sign language. We very often miss these groups that might be groups with disabilities, citizens with disabilities that often are not included in all of our general policies. Everyone is doing things at a very speedy pace, but it's something that's worth pointing out. We will get back to you if you have any questions, if there are any questions from the participants later on in the panel. And I just want to extend the thank you, and this is, I think, a very welcome thank you for everyone who works in healthcare, to decision makers, to doctors, to nurses, to administrative workers, everyone who is living a very different life from most of us here on this conference right now, and has been doing so since the start of this year. I think that it's just fair to recognize that and say a thank you to everyone who's risking their lives and their commodity to help the world and their countries in this situation. I will move on to the next panelist. We have with us Professor Nenad Markovic, a renowned academic who I'm very happy to see in this panel, and a professor at the Faculty of Law at St. Cyril and Methodius University here in Skopje. Nenad is an author of numerous publications in political theory, in social sciences, in social capital, in nationalism. But most recently, let's say, we had the opportunity to read his papers in a 4-piece series called Democracy in the State of Emergency in the Western Balkans, Croatia, and Slovenia, which was published by FES. This covered the impact COVID crisis had in these societies. And I think it's also worthwhile to just mention and put it out there that Nenad is also a member of the Security Council of the President and country. So I'll throw a quote from one of your papers, and it was written in July, but I think it still remains valid. And you'll tell us how you feel about that. And then we have a presentation on social distancing that we'll be able to follow. So the quote or the extract I read from one of your papers on this topic says, "The first lesson is that North Macedonia has a very serious problem with the part of the population that does not believe that the virus exists at all. Secondly, if North Macedonia decides to reintroduce prohibitive measures at all at any point, these measures must be applied equally and without political compromise, given that the initial set of restrictive and prohibitive measures achieved very little result. Thirdly, in no way should any restrictive or prohibitive measures affect the reopening of economy, or any effect these measures do have should be minimal and only in drastic situation. Now, I found all of these 3 points to be very fitting to the panel we're having today, and I'll throw in a few more questions for you during the presentation. Because due to the crisis, this trust grew deeper between citizens and institutions, or did they become more understanding? What do other stakeholders play in this crisis, and how are they dealing or contributing in resolving the crisis or causing even more turbulence? We have the religious communities, we have civil society, we have media, we have a lot of actors that are playing a role in the crisis, but it's unclear whether and to what it contributes at every point. But without any delays on my part, I will invite you to have this presentation for us that I'm sure everyone is very interested to see. Please.
Thank you, Donna. You had all the right questions. Greetings to everybody. Greetings to all the participants and everybody that took their time to be here today with us. I honestly feel honored that I'm the only one that's semi-online. I'm here in the studio. So basically it's closer to the real experience. And all of these questions I will try to answer in my presentation called social distance and distrust, which I hope you can see on your screens, trying to just briefly add some points to the whole debate and to the beautiful introduction that Donna gave. I guess that one summary to your question would be, one summarized answer would be, maybe we should revise or revisit or rethink what emergency is and what drastic situation means. I think that the scope or the dioptry we used in March and the dioptry we use today is completely different. However, I would like to start my presentation by explaining two different terms that we usually mix up. In the whole situation with the COVID-19 virus, SARS-CoV-2 virus, we seem to be forgetting that social and physical distance are not the same thing. And I kind of lean on what I wrote in this series on the state of emergency and democracy, plus on what Minister Filip just said, where practically physical distance and social distance are not the same thing. What we are trying to do in order to stay safe is to maintain physical distance. But in fact, we are trying to improve social relations as much as we can through new technology and other methods that can be used in such a situation. So physical distance is not equal to social distance. Maintaining physical space between individuals is physical distance. This is what we need in order not to transfer and transmit the virus. But this is not the same thing as lack of social contact or involvement, lack of social interaction, and it's the second thing that usually gets to us in this crisis and causes all these psychological problems that we discussed previously. People seem to equalize to two terms that are completely not equal. My professor, when I was studying in Sarajevo, Bologna during my MS studies a long time ago, Janja Bech-Neumann, used to have a very nice quote saying that physical distance usually implies social distance, but in normal circumstances. When somebody is sitting far from you or doesn't want to get close to you, it also implies that there is some kind of social distance between the two of you. It might be religious, it might be ethnic, it might be ideological, it might be personal. But in this situation, it's completely different, and as Minister Filipče said and explained, the paradigm has completely changed, and we shouldn't also mix up social distance and social separation, or physical distance and social separation. Maintaining physical distance should not lead to social separation or complete exclusion from all processes, especially as we saw in the last period, especially in situations where people are quarantined, have to stay at home, where potentially whole families are infected or potentially infected, etc., etc. I don't want to repeat the previous panelist. So then we're speaking distrust in general. What we should know about the Balkans, and it turned out to be a very global phenomenon, distrust is a starting position in the Balkans. For instance, if you have seen public opinion polls prior to the COVID-19 crisis in the last 10 to 15 years, even more, then you will see that general trust and even institutionalized trust is one of the worst in the Balkans. For instance, North Macedonia in the 2000s had social trust, general social trust, somewhere near 10%, which is pretty low. I hope this microphone now works better. I was told to fix it a little bit. Sorry if you couldn't hear me well. and it dropped to 10%, which is dramatic. This is determined by the question, do you generally trust other people, or you think you should be careful with them? So generally this region, and it turned out, I will repeat, to be a global phenomenon, has very little trust. People have very little trust in each other. Then political polarization on the global scale, the presidential election in the United States, as we speak, are displaying this phenomenon, is pretty global and pretty intense. This is not something that was, in the 90s, it was used to mark countries such as Poland or Ukraine or several others, but it became, in the meantime, global and regional phenomenon in the Balkans, huge political polarization of societies, followed by the enlargement fatigue and the so-called credibility issue of the European Union that we can widely discuss, and it's part of this trust-distrust binary relation between the candidate countries and the European Union. I don't have the time to go into that, maybe in the discussion later, but it also contributes to this whole debate. However, what is worse and why distrust is such a strong starting position for the region and for our countries, the long exposure to uncertainty. It has been a long, not very successful transition from one regime to the other. It has been a long and not always successful road to EU and NATO. Inter-ethnic relations are still very cumbersome, burdened with ups and downs, so to say, and there is still a predominance of so-called survival values, where people are trying to solve the economic issues, and that really is some kind of a trade-off with liberal democratic issues. You usually cannot have both, as political science would testify. So what is the general mood of people? Why do people seem to have such a conservative mindset on the Balkans? But it's connected to the two most important conservative perks. A friend of mine, a political theorist from a colleague of mine from the faculty, reminded me that there are two fundamental conservative values shared. Global ever since conservatism as a phenomenon was examined. It's need of closure and uncertainty avoidance. And this is where we score very high as societies. It also turned out to be a global phenomenon, not just North Macedonia, not just the region of the Balkans, but it's a general phenomenon. However, this is more or less normal in times of crisis. People need closure, and people need uncertainty avoidance, which leads to a more conservative mindset, which is, I would once again restate, quite normal in times of crisis. The crisis of 2007 displayed that this is rather true. Then you have the motif of the virus doesn't exist, the distrust towards the very existence and seriousness of the SARS-CoV-2 virus. Why this happened? I'm not a psychologist, I'm not a psychiatrist, but it's quite obvious even from the standpoint of political science what happened. The distrust towards the virus is, in fact, in its essence, is inability to cope with the newly created situation. We cannot cope, and many people cannot cope with the newly created situation. That's why usually people go into denial. This comes or stems or derives from the need for rationalization of events. We need some closure, we need uncertainty avoidance, as I said, and in this regard, psychologically, it is better to say that it doesn't exist at all than to try to rationalize it some other way. The funniest thing happening, in fact, it's not funny at all, it's just peculiar, so to say, is that the feeling of losing of control under the circumstances is compensated by so-called inflation of importance. That Bill Gates is following us, that he will put microchips in all of us. It's kind of inflation of personal importance that compensates for the feeling of lost control among people. And then there were the confusing information, as the previous panelist said, nothing was known about the virus. The virus did everything wrong and everything completely different from other viruses. It was a complete novelty, yet people are still trying to this date to interpret medical phenomena such as the COVID-19 virus in a situation when even doctors can't. Why? To fill these gaps of knowledge that exist in our mind, but we are not, I am not, and general public does not have the critical apparatus to do so. Yet we are still trying in order to fill the holes that I was discussing in this rational approach that we are trying to implement, so to say. So this showed, the COVID-19 crisis showed that there is this uncertainty avoidance on a global scale. We are trying to fill gaps in knowledge regarding a completely unknown phenomenon. And people cannot accept that at some point this is impossible. It will be a long time will pass until we know all the details, all the shades of gray regarding the virus and how it acts. And we should wait for the medical profession to give its standpoints and then maybe comment. However, people tend to tend to rush things in this regard in order to fill the rational gaps in their minds of how the virus behaves. We cannot live with uncertainty, which uncertainty probably is also caused with stress and the inability to cope with it. What do public opinion polls show? Well, I will be very brief. I took the only credible until date, although 2 new were published, just to illustrate what I am saying. The Macedonian Center for International Cooperation published a poll, and I will just run through it because my time is slowly passing away. Sorry for my technical skills. I'm very basic at this. I try to just very basically translate what is and not desecrate the slides, so to say. As you will see, around 10.3% of the people in our country don't believe that the virus exists at all. Additional almost 5% say it's consequence of 5G networks, although we don't have a 5G network in the country. Intentionally made in the lab, 36.7%. I should even mention that all these are completely phenomena connected to conspiracy theories and not scientific facts. And there are even ethnic differences in the country. For instance, Macedonians, the blue columns are Macedonians and the orange columns are Albanians. The Macedonians are more prone to think that it's made intentionally in a lab, while Albanians are more prone to think that the virus doesn't exist at all, while there is an equal distribution of 5G believers, so to say, in both campuses, although there is a general concern of how the virus, very worried 28.6 and somewhat worried 42.7. There is a general concern. Maybe this unconcerned part of the population is quite smaller, but it's enough to contribute to general distrust on how the virus. Then there is the problem of personal distrust. The need of maintaining physical distance inevitably creates mental barriers to social distance. And as I can see, there were 2 radical approaches and everything in between. So the first approach was everybody's my enemy. Complete social exclusion, complete extreme isolation, which probably leads to these 5,000 cases of people calling support lines to cope with psychological problems. And then there was the other pole, so to say, the other radical approach, which was a complete laissez-faire approach. Completely loose behavior and not taking precautions, which probably contributed heavily to the spread of the virus. In between, there are many shades of gray, but personal distrust was an issue in the whole crisis. Then again, there is political distrust and polarization on national level. There was deeply polarized political climate on global scale. And it kind of put in front a very important political science dilemma: security versus freedom. COVID-19 virus once again showed, as many other authors such as Thomas Hobbes showed centuries ago, that you cannot have both. You either have security or you have freedom. 9/11 has showed out, COVID-19 has showed them, fight on terrorism has showed us, you either have security or freedom. Equality versus freedom is not a dilemma. You can have both, or try to have both. But security versus freedom is kind of an exclusive relation, binary relation. In general, the virus favored political forces in power, but it was an ideal storm for any opposition, and it spurred the debate on nanny state versus liberal state. There were 2 approaches. We wait for the state to solve the problem of the virus, regardless how careless we behave, or we don't want the state anything to do, regardless of our personal behavior. Both approaches have their critiques, both approaches have their advantages, and it's kind of a trade-off between the 2 because obviously you cannot really have both. What did societies polarize on? Approach, liberal versus restrictive. Measures. Should we do the Swedish thing and go only for physical distance, or quarantine and introduce movement restriction? Coercion, liberal versus coercive approach. How much does the state interfere, intrude, and punish? Results, sorry for the typos, minimal economic damage versus minimal loss of lives, and the cost of measure, economic damages versus damages in lost lives. Obviously, these are all binary relations that cannot be achieved or can very hardly be achieved on a global scale in any given country. And for the last slide, and I'm finishing with this one, the distrust among states. I call this slide the global blame game. The first global blame game was China as the global culprit. We still don't know the origin of the virus. We have no idea whether this course can be logically supported or not. But I think the discourse was very present. This discourse was very present in the very beginning, although it brings no benefits. Then the second discourse, which contributed to the global blame game, was: did the EU fail in response to the crisis? And it reiterated, it kind of restated the sovereignist versus globalist debate with kind of a substitution of thesis. In fact, the EU did not fail because the EU has very little to say when it comes to national healthcare programs. It was in fact the failure of the sovereignist model and national states because they responded to the crisis. The EU got organized more or less very quick. Then it was the blame game of the imported virus. Every state claimed that they imported the virus from somewhere, that there was no local transmission until this argumentation made sense. Then travel restrictions were introduced, which were more political than medical. And the latest thing is the mini Schengen initiative, opening of the borders in the peak of the crisis, which tells you a lot about